again, the vast majority of bar owners are doing a good job.
Here it is. The news about the coronavirus.
Cracking down on those.
That's right.
So that will be
the news about the coronavirus.
To state the obvious, one of the requirements that our working group was made up of bar owners, health people, restaurant owners. One of the recommendations they came back with was that in a bar, people must be seated. They cannot be seated close together. Take a family group, whatever, but they have to be seated. Where we see the horror stories is where people in bars are bunched up together, and that just does not, that simply does not work. Let me turn it over to Lieutenant Governor John.
Thank you very much, Governor. 4 items today. First of all, a technology update. Governor, I can happily report that the tech team has reassured us that while they're having technical issues, they weren't hacked. So they're working through these. They did want to let us know, though, that the case reporting system, that they're still having trouble with it. They're going to update that information for you out there as soon as they can. But they're just working through those technical issues. They hopefully will have them resolved soon, as they've reassured me that they are on top of it. A couple of items regarding schools that I think are worth emphasizing. Governor mentioned how much great conversation we had with local educators. And I think that the fact that so many people are out there talking about wanting to go back to school really emphasizes the value that schools have in our communities and the great things that educators do for the children of this state. But the educational landscape is diverse. We certainly learned that. We have many rural schools, many suburban schools, urban schools, private, public. They all have unique settings and unique challenges when it comes to creating a safe and educationally vibrant environment as students return to school this fall. And the school leaders ask for flexibility. That was one of the things that they asked for when they make decisions about transportation and physical spacing and educational programming, mindful of the unique resources and the changing environment that we saw happens in our communities from time to time with the spread of COVID. And this is consistent with what the American Academy of Pediatrics said. They said basically that as Governor mentioned, strongly advocating that all policy considerations for the coming school year should start with the goal of having students physically present. And the guidance says schools are fundamental to child and adolescent development and well-being. And that's what, in the end, education is about, what our education system is about. And living with COVID-19 in our lives is going to be a reality throughout the entire school year in the absence of a vaccine. And schools are that essential part of human development. And for the vast majority of students, the consequences for not attending school this year are far greater than the long-term health and well-being risk posed by attendance. And I can say this because one of the things that I live with every day is I have school-age children. And Tina and I welcome the return of school. We are going to have our children return to public school this year. I know that they're excited about it. And Governor, I will tell you that Kylie is very excited about it. She asked
the news about the coronavirus.
Go back to school this year, and I answered her yes.
That's right.
So
the news about the coronavirus.
She was excited about that, and we do want to have a successful return to school, and the guidelines in that plan will help schools design the program that will work best for them. I want to thank the team that worked on the schools, and also thank the team that worked on the localized system that we have that the governor announced. We talked about this for a long time, but we weren't able to do it before because we didn't have the testing. We didn't have the data and the tracing that allows us to have the knowledge about where the spread is actually occurring. And now that we have this localized system, I'm excited about the information that can be exchanged locally, the conversations that can go on in those local communities about what to do to control the spread in their communities. And localized information is always much more impactful in our lives, because I know that when we think about the just our country. If you hear news that's happening in Washington, may be relevant to you, but it's often the nation's capital, may not affect your daily lives. If you hear about what's happening at the state capitol in Columbus, also important, a little closer to home, a little more impactful in your life, but still for many people can seem distant. But this data, this system at the county level, at the community level, really can help people understand the risks and what they can do about it and drive those conversations that can be real and persuasive in a business, for individuals, for families, about what they do in their lives and how they can help assess the role and really individualize how each person can be part of the solution. Because that's so important. Each one of us is part of this solution by what we do in our lives. We have very few things we can do, and we know more about them every single day. And as we approach Independence Day in a COVID world, it just makes me think that freedom and responsibility are even more special companions this year than ever before as we look to control the coronavirus and exercise our freedoms in this great nation. And then finally, one data point that I want to talk about today. We've had a lot of questions about who's recovered from the coronavirus. Can you tell us those numbers? And we've really worked hard on our data team on refining, clarifying, and sharing the coronavirus data as we learn more about the virus. And today we'll be announcing that new data point, which will be included in the coronavirus data metrics that's shared on the website. Many have asked about that recovered number. While we can't know specifically, because if you go get a test, you find out you have coronavirus, you self-quarantine, you may never interact with a public health official or a hospital. And for many people, that's the case.
The news about the coronavirus.
Verify every case to know if
that's right.
If that data.
The news about the coronavirus.
What we can do is come up with a presumed recovered number, and I'm going to tell you how we're going to come to that number so that you understand it. We're going to take the number of cases, the overall number of cases, minus deaths, which unfortunately we have too many of those, and then cases based on onset data the last 21 days, and that will be our number that's presumed recovered. And today the number you will see is 38,987. Now, you can't just add those numbers up on the website and come to that, because there are always people that unfortunately appear in two categories: those who have the case, who have developed coronavirus within the last 21 days and also fall into the death statistic, unfortunately. So I know that people have asked for that number. We work with the data team, we work with the health team to come up with something that we believe is an accurate number based on those sets of factors, and we will include that number on the data profile on the coronavirus website. I know, trying to be responsive to those who've asked for that number. So, Governor?
Ready for questions?
Good afternoon, Governor. Jeff Reddick from ABC 6 News here in Columbus. On the school reopening plan, the one thing I didn't see addressed is what happens if a staff member or student in the building tests positive for COVID-19. Is that guidance included in your plan?
The general guidance is yes, it is, and I didn't include everything that's in the plan. I put everybody to sleep for an hour. I figured that there's a limit to what everybody can endure, but yes, it is very much in there. Yeah. So when they're, every school has to develop some testing protocol, and I didn't mention this before, but the ability to get tested is going to continue to change. It's going to continue to get easier, and it's going to continue to get less intrusive. So I think when schools are planning, they should understand that that's going to happen, and so there needs to be some school planning in regard to testing. That doesn't mean schools are going to test everybody. I don't mean that, but based upon good medical evidence when testing should be done. Of course, they have to work and must work very, very closely with the local health department. That's who they should seek guidance from.
Good afternoon, Governor. Karen Johnson, WLWT, Cincinnati. You said 6-foot distance must be maintained as much as possible in the schools. Why 6 feet when the American Pediatrics Association says 3 feet? School districts I'm hearing from are saying 3 feet is doable, 6 feet nearly impossible when putting kids back to school 5 days a week.
These are aspirational. There's no requirement. If you look at what I said, and then when you read the report, the only requirement is that we're going to put an order on that every employee, every teacher, etc., wears a mask. That's consistent with what we've done in other sectors across the economy. The rest of it is, this is what we highly recommend. But we also know, and I've stated, and the document states, that there are times when you're not going to be able to maintain that distancing in a school setting. So it's, as I said, it's a matter of common sense, how you try to achieve the best that you can every single day to educate young people, get the feedback from them, go back and forth, teacher with them, at the same time do everything you can to try to keep them safe. If you look at the 3 foot that was stated, the context was, and I believe it was the, as you said, American Society of Pediatrics, that came up in that document when they said, in this context, that if the choice was to be able to put kids only 3 feet apart in school, or having half the kids not go to school but do remote and then switch it, their recommendation, their strong recommendation, was go to the 3 feet. That's how the 3 feet came up. I don't know anyone who would prefer 3 feet to 6 feet, and it's all relative, and it's all just somewhat arbitrary. The more distance you can maintain, the better it is. But schools are going to have to live with the science, and they're going to have to do the best they can. And I trust our schools to do that. I trust the people who run them. I trust the parents to do that. A bus presents a unique problem. You're in a bus. Our grandkids, I think, were in for an hour. I've had kids in for an hour. It's an enclosed setting. Schools can't go out and double their buses. So there's difficulties. But you try to figure out how do you adjust to do that. And schools will come up with different ways of trying to do that. It may be a school says every student, no matter what age, wears a mask while you're on the bus. It may be assigned seats on the bus. It may be that you're assigned, and if there are 3 family members get on the bus, they got to sit together on the bus. I mean, there's all kinds of ways. We don't intend. It is not right for me or the health department or anybody else to try to micromanage, 5,000 school buildings in the state of Ohio. We trust the schools to do that. We set the guidelines. We did one mandate. We had high recommendations for the other things, but ultimately the schools will do a good job.
Good afternoon, Governor. Josh Roltenberg with Spectrum News. On Monday, we had asked if there was a certain number of cases in which you would take executive action to stop the spread. We're just wondering, is this new color-coded system exactly that? And what are you going to do if a county reaches purple?
It is the new system. I think is the best that we can come up with, because it takes into a lot of things into consideration. And I think the scientists will say, and the medical people will say, when you're taking 7 things into consideration and not just one, the odds are of getting it right go dramatically up. And if you were just looking at cases and nothing else, you could have some outliers, some things going on. But what the process is going to be, this is basically objective standards, but in reaching whatever level that county comes up with, or we come up with for that county that week, we're going to have consulted with the local health department and talked with them to see what data, that they have. But this will be an indicator for the local officials. This will be an indicator for everybody who lives in that county. To the best of our knowledge, this is where you are in this fight against COVID-19. So they will be informed, mayors will be informed, and I'll be informed. And everybody will be informed by that. And when we make decisions in the future, we're going to try to make them. You've got a baseline set for everybody, no matter where you live in Ohio, because the COVID is everywhere in Ohio. But the additional steps that might have to be taken will be taken, at least it's our intention now, to take those on a county by county basis. You've already seen with the new data that everyone is looking at, that Dayton Mayor Ann Whaley, Columbus Mayor Andy Ginther, both have now set in motion a masking ordinance policy, and I believe I read that Mayor Franley was thinking about it. So I want to thank them. I thank the city of Bexley. They're doing the right thing. They're reading the data. They're following it. And so that's the right thing to do. That's what data is for. That's what this information is for, to try to inform good decisions, whether they're made by a mayor, a city council, or the governor.
Afternoon, Governor. Max Philby with the Columbus Dispatch. Given your support, as you just expressed it, for the face coverings that have been mandated in cities across the state, is there any chance that you might institute such a mandate for the whole state, and why or why not?
That's not our intent. Our intent is to, again, try to treat counties based on every county we know is COVID. Every county is in the best interest of people to keep a distance. It's in the best interest of people to wear a face mask out in public. All the other things that we have put in place for businesses should apply statewide. But with new data, new information, if it's necessary to go further and take actions, we will be able to pinpoint those and to take appropriate action. This is something that, quite candidly, that many members of the General Assembly have talked to me about in the past and requested that we be able to pinpoint if there is a problem. Many citizens have also said that to me. We now have the ability to do it, and as long as we will continue the underlying rules, but pinpointing what we have to do to try to deal with a specific problem is what we'll do. And look, it's not just Mike DeWine announcing some order or the mayor announcing some order. What this data does and what this color does is it informs us of where we have a problem or where we have a big problem. So, we have been surging in, for example, as you know, into Dayton. We've been surging into Hamilton County, Montgomery County, help in regard to more testing. I talk with Mayor Ginther a lot, and we're talking about more testing here. The new data shows me that we have a problem in Trumbull County. We are starting to work with officials there in Trumbull County, and I'll be asking my team, hey, what are we doing about Trumbull County? What are we doing about Huron? What are we doing about the ag workers? I mean, we have a whole series. As soon as I saw this the other day, I said, we got to move on Huron County. What's going on? And so we started things in place. John got on the phone. Others did. And so it informs us not just to put orders on where we restrict something. It informs us to be able to surge in with more resources to try to turn the tide, to turn things around before they go even further south on us. So data's important, information's important, it helps inform us.
That because I thought one of the great conversations that I was involved in recently was the conversation we had with local health leaders across the state. I believe we might have had this last Saturday, where they talked about wanting to have a localized system so they could do the work of public health officials to create the collaboration, to inform people, to get the buy-in, to localize the solutions and the consequences. That they thought that would get better results with better buy-in. When you involve people in the decision, they tend to embrace it more, and you get better outcomes. And we hope that that's what the localized system is going to bring us. The local health officials were asking us for this. They were involved in the collaboration for us. That collaboration is necessary. We can make all the policies we want, but we have to get buy-in at the local level to make them work. And no matter what the color of your county is, a face covering is a good thing. It's a respectful thing. It's armor to get us through the fight. And it's like we're going to suit up. We're going to do this. We're going to allows us to live our lives and also protect our family, friends, and loved ones. And so that's a culture that we want to develop beyond your color code. Wearing a face covering is a good thing no matter what the color of your county is.
Kevin Landers, WBNS 10 TV. Governor, you've watched these cases climb in the state, but there doesn't seem to be the buy-in that you had hoped for. And I'm wondering how frustrated you are about that. And when it comes to mandatory face masks or reducing occupancy in bars or reducing hours at bars, you haven't addressed that. And I'm wondering if you've thought about that, if you think that's an option. Thank you.
Thank you. It's a very good question. My experience with Ohioans, 73 years worth of experience, is that we are people that are practical. We work hard. We look at the facts, and we make our decisions based upon that. I think what you saw us unveil today with the new map gives us an opportunity to continue that discussion with the people of Ohio based upon facts. And I think when Ohioans see what is happening, we're going to control our future. Ohioans control what's going to happen. Are we going to look like Florida? Are we going to look like Texas? Or are we going to look like Ohio has looked like over the past few months up until the last few weeks when we just turned this thing down? Turn it down. We did it. So we can do that again. So I have faith in the people of the state of Ohio. But you got to give them the information. We're giving them the information today. We're giving local elected officials, people who represent people at the local level, the data that they need. And so, look, if you're a red county today, you got to be looking at that and saying, okay, what else can we do? And for these health departments, it's not a surprise. They've seen their numbers. They know what's going on. But it might be a surprise for people in the community to know, okay, well, we're red. Or in the case of Franklin County, not only are we red, but we may be moving into purple. That should be all of this should be a wake-up call to Ohioans. This should be a wake-up call to all of us that we are in the fight of our lives, and we are literally fighting for lives. We're fighting for our future. We're fighting for our ability to be able to expand our economy and grow our economy. Because I will tell you, it matters not. I get questions a lot about what are you going to order? Well, whether I order anything or not, I will tell you, if people are scared and the virus is taken off, the economy is not going to recover the way we want it to. So for my friends who are headed up to Put-in Bay, or my friends who are going to be in an establishment here in Columbus, I would just say, look, we control our future. We control what we do. Fran and I were at a funeral of a friend this week. We wanted to go up and hug the widow, but we couldn't do that. We couldn't hug her. But we just all have to. We're in this together, and what each one of us does. So this information should inform people. I think it should fire people up. I think it should get people excited and say, hey, We're tougher than this. We're not going to let this happen to our state. We are not going to be Florida. We are not going to be Texas. We are not going to be Italy. We are not going to let this happen. This is a long battle, and we won round one, maybe round two, but this is 15-round heavyweight championship, and we got to stay in there and we got to stay punching.
Hi, this is Jessie Bummer with the Inquirer. I suppose I'm still trying to understand, if I'm a resident in Hamilton County, which is a red county right now, and it says limit activities as much as possible, what does that mean? What might change about my life if Hamilton County upgrades to a purple county, or businesses? Like, what is the difference for an average Ohioan?
We've laid that out, and you'll be able to pull that, anybody will be able to pull that down online. But I will summarize it basically is that when you get to red, and you're only one of a handful of counties in the whole state that are red, that tells you there's a problem. It tells you this monster is running loose in your county, and it's looking for victims. It is looking for victims. So you just need to be very careful. It's there. The presence is there, and it's moving fast. And so there's two things we can do to cut it off. We test more, and we hit 20,000 tests 2 days ago. I haven't looked at what current numbers are, but 20,000. It wasn't too long ago we were at 8,000. So, and we need to frankly double that again. And we're going to do everything we can to do that. And that's more on me, it's more on the mayor, it's more on the county commissioners, it's more on the health department. We have to make those tests available. Then people have to go get those tests. That's on everybody. The other thing that we can do is to be careful. And, you know, what we're finding is, you know, we shouldn't think that this is all caused by 20-somethings who are going to bars. Yeah, that's a problem. But it's not the whole problem. It's people being careless. It is people, you know, doing things that they want to do that are natural to do when they could have done the same thing and be a little more careful. You can, you know, you go out and a number of members of your family are together. It's summer. We can be outside. Be outside. Wear a mask. You know, and it's just what we do in our lives. And I think Ohioans are, you know, the more information they get, the more appropriate action that they can take. I mean, everybody should social distance no matter where they are in the state. Everyone should wear a mask when they're out. But you got to be extra careful. If your county's red, that should be a real wake-up call that there's something going on, and it's not good.
Good afternoon, Governor. Marty Schladen, Ohio Capital Journal. I wanted to follow up on Max's question. Isn't waiting to mandate masks until an area is a hot spot, waiting until the horses are out of the barn, isn't mask wearing a way to keep a place from becoming a hot spot?
The answer is that it is a way of keeping a place from being a hot spot. And so my message, if you're yellow, if you're orange, if you live in an orange county or a yellow county, and you don't want to move up and see things get worse, you have it totally within your control collectively of what you do in that county. So people can control this. It's their everyday activity, and I'm not ruling out doing additional orders. I'm not saying we will not do that. We're seeing mayors, for example, in a number of places, as you saw,